Hi guys, I'm going to tell you about the acid-base imbalance, how to solve their questions. We oftenly get these questions as MCQs. So you have to remember these few values like pH values and PCO2 values and bicarbonate values. Some book says this bicarbonate values is up to 28, but I used to use this 26 values limit. And what I use this formula as a, or you can say this relationship, like P is directly proportional to bicarbonate values and indirectly proportional to PCO2 value. That means if bicarbonate increases, that means pH will be increased, or if PCO2 increases, that means pH should be decreased. This formula will give you a very easy approach to solve your questions. And always remember, bicarbonate is a metabolic interpretations and CO2 is a respiratory one. It will be like acidosis, alkalosis, respiratory acidosis, respiratory alkalosis. Okay, so if there is any imbalance, so our body will try to get compensation by in the same direction. What does it mean by same direction? That like if bicarbonate is decreasing, that means our PCO2 will also decrease, or if PCO2 decreases, then bicarbonate will also try to decrease and compensate the pH values. Similarly, if there is any increase, then another component will also increase to make a compensation. Okay, so if there is a metabolic acidosis, what will happen? That there is a bicarbonate component will be decrease. Similarly, if I use this formula and this formula, what will happen? Because of this bicarbonate component is decreased, that means pH values is decreased. That is a metabolic component. Why metabolic? Because of bicarbonate component is decreasing. So for the compensation of this decreased bicarbonate value, our body try to decrease the CO2 value, and it will decrease by 1.3 mmHg per 1 milliequivalent bicarbonate drop. Similarly, if there is any metabolic alkalosis, there will be increase in bicarbonate and PCO2 will try to increase also. I told you, because this compensation will be in the same direction. Okay, so if our body get increased bicarbonate, and for 1 milliequivalent there will be 0.7 mmHg increase in PCO2 values. Similarly, if there is a respiratory issue, if our CO2 value increases, like, then there will be respiratory acidosis. I told you, according to this formula, CO2 increases and pH will be decreased in a opposite direction. A relation is inversely proportional. So there will be, body will try to compensate again in the bicarbonate to increase, because this PCO2 value increases. So how? There will be two component, acute and chronic component for the compensation. If 1 milliequivalent increase in bicarbonate per 10 mm CO2, it will be acute. For chronic values, for this is will be 3.5 per 10 mm CO2. Similarly, if there is any alkalosis, that means there is a PCO2 value decreases, and body will try to decrease bicarbonate by losing the bicarbonate from the body, by excretion, whatever. So how does body will compensate here? For 10 mmHg, for 10 mmHg CO2 values, if drop 10 mmHg, then there will be 2 milliequivalent drop in bicarbonate also to fully compensate the body system. Similarly, there will be 5 mmHg, that means a chronic. Just 2-3 values you have to remember and you will get your answer very easily. This is how I going to approach this question. This is pH value 7.47, PCO2 value, and here I am going to put our formula pH in directly proportional to P sorry bicarbonate by PCO2, right? So here this CO2 is increasing and bicarbonate is also increasing. So if I put bicarbonate here increasing, that means pH increasing. This two values fulfill our relation of this pH bicarbonate and CO2. But if I increase this PCO2 value, that means pH is increasing. This will not fulfill our that. If PCO2 value increase, that means pH value should be decreased, but this is not fulfilling our this relationship of pH bicarbonate and PCO2 relation. So there is a same direction. No, pH is also increasing, bicarbonate is also increasing. That means PCO2 is compensating the bicarbonate component. That's why this is what is the final diagnosis, because here bicarbonate is increasing. So this is a alkalosis, metabolic alkalosis. And if you look at the pH values, this is 7.47. that is not in the normal range, that is a partially compensated. This is all.